So I'm going to talk about the good, some of the benefits that we have been able to prove or show that from lipedema reduction surgery and the bad, some lymphatic injuries. And many of these slides are part of, were actually part of a publication that just got accepted for so they're from the American Journal of Case Reports. So prove it. We need to prove that what we're doing when we're removing lipedema tissue is benefiting. It's crucial that we prove this to our patients, to our fellow physicians, and ultimately to our payers. So I'm going to some of the outcomes I'm going to share with are from the PROMISE, which is an NIH-developed toolkit, highly validated, that measures patient-reported outcomes, and the other is using the RAND short form SF36. And these measures are used in for many different diseases. So we can look at the outcomes from the lipedema reduction surgery and compare them to what we do for things like knee replacements, back and neck surgery, and treating osteo and rheumatoid arthritis. So this is the results. These are of pre-op, and I'm going to see if my, So these are the different domains of this SF36, and we can see that the normal population is, and this is scaled 0 to 100, runs around 70, and below this is just in my practice, the average is around 56, and then post-op they are right at normal. And same role of physical functioning, role of emotional functioning, energy and fatigue. And so you're seeing here that these are all significant changes. So these are all at least a T-score or better in terms of the improvements in these different domains. And then this is just at graft, and you can see here that there's in each of these domains of physical functioning, all part of your health quality of life, that they are improving. And if you look, these compare very favorably. So they're at least as good as what of using the same measure as, for example, the benefits of someone with chronic low back pain or chronic neck pain and numbness or something from cervical disc disease. This is the kind of improvements that these are very comparable or slightly better. Here's looking at the PROMISE things. We can see, again, 15% increase in walking at normal speed, 18% increase in going up and down stairs, increasing from 15% improvement in getting up from the floor, and running short distances, etc. How do the PROMISE things compare? Well, so the average PROMISE mobility score is around 51, and again, and improves to 62. Now that's a 10-point improvement. And the literature says that a 2 to 3 point change is considered minimally clinically important, and that in the literature they consider that a good response. For example, that's the kind of response in one study showing in total knee replacements, their mobility improved 3 points, and in a second one it improved 5 points. So I don't know if I can say this is twice as good or 3 times as good, but I know that I mean, we certainly don't have to fight as hard for people to get knee replacements as we do lipedema surgery. And so similarly on rheumatoid arthritis and osteoarthritis, a 2 to 3% change. And then we also measure, objective physical endpoints. So, everybody, of course, their leg size decreases, et cetera. We also show some improvement in bioimpedance or edema in the tissues, but also we're seeing, oh gosh, can I go back? Yeah, okay. We're seeing about an 8% improvement in the knee range of motion, 8% in the knee leg alignment at the knee, and a 2-degree improvement in the Q angle, and an improved gait in about 84%. Liposuction and lipedema. Liposuction I consider a cosmetic procedure, and it's different. It's one of the most common procedures performed worldwide. It's usually done in healthy individuals close to ideal weight with normal lymphatic function, and it's a cosmetic surgery. It's focused on optimal fat removal for maximal aesthetic results. But there are derivatives of liposuction, and what I'm describing is lipedema reduction surgery, which I consider a derivative of liposuction. It's not, obviously the goals are different, the techniques are different, and so when I say lipedema reduction surgery, it is I'm talking about a derivative of liposuction and not liposuction. So lipedema reduction surgery is focused on pain relief, improvement in function, and maximal removal of the hypodermis. That's not just fat, but also fibrous tissue and extracellular glycosaminoglycans, and it's larger volume. Just like it's not unusual. I mean, again, it varies on the patient, but very larger BMI patients, and who can remove up to 12 liters. Now that's not all when we're focusing more on the hips and thighs. We don't, of course, get that kind of from other areas. And the average, lipedema patient on average average BMI is around 42, and of course we do larger areas treated, and it's a longer procedure. The average procedure time is around 4 to 6 hours, and we do a lot of measures to protect lymphatics. Now, every surgeon who knowingly treats lipedema may use some procedures to protect lymphatics or none, and no two surgeons perform it exactly alike. We do all of these. We preoperatively map the venous and lymphatic structures. We use smaller cannulas, blunt cannulas. We use longitudinal techniques, and we do multiple positions for optimal orientation of the cannulas. But I mean, that's what we do. I really think I think all these other surgeons here do a very good job. Everybody does it a little differently. Now I just want to spend a minute. There can be complications, and we need to talk about complications. So this is a patient who had lymphatic injury, and you can see pre-op and post-op, and that's 6 months post-op, and this is these warty hyperkeratotic papillomatosis, which is fibrosis caused by fibrosis of lymphatics, and this is their lymphocitogram, and you see delayed uptake in their lymphocitogram. There's another patient who had who developed lymphedema in her foot, and That's a close-up of her foot on the right, and here is their lymphoscintigram, and this is a third patient, and they all had different techniques, and so in conclusion, liposuction is not, lipedema reduction surgery is not liposuction. It's shown to improve pain, mobility, physical function. Liposuction can injure lymphatics and lipedema, and more study is needed to how to optimize the surgical treatment of lipedema. Thank you very much.